Many of us say we want to stay at home as we grow into old age. But as economics correspondent Paul Solman recently reported, the country is facing a shortage of home care workers, the very people who can make staying at home possible. Tonight, Paul looks at efforts to address that shortage. It's part of our weekly series, Making Sense.
America's home care shortage is critical and growing.
All right, Tom, come sit down for breakfast.
Right now, 90% are women who help older adults and people with disabilities get through the daily tasks of living at home. The key drivers of the shortage, according to gerontologist Claire Luz:
low wages,
Right.
Virtually no benefits, lack of guaranteed hours, and lack of respect. Those are the big ticket items.
The pay, a national average of $10.49 an hour. And that's not nearly enough to make up the shortage, says MIT management professor Paul Osterman.
We have to find ways to make these jobs for these home health aides better jobs so more people are willing to do the work.
On the demand side, the reason is obvious and pressing. The number of elderly and disabled in need of assistance is expected to double in the next 25 years.
It's going to put tremendous pressure on unpaid family members to step in, but they're not going to be there in the numbers that we need.
It's very hot.
There aren't enough Helen Quantz, that is. She's been caring for the elderly since she arrived from Colombia at age 22.
You're now how old?
87.
And you're still doing it. How old is the person you're taking care
87.
Helen's daughter Martha is also a home care worker.
My mom raised us to care for our elderly neighbors, so since we were knee-high to boll weevils, we were taking food and
Yeah, we
helping do
adopted
this.
like a grandma.
But Martha wonders if the rest of her fellow Americans are equipped to take in aging relatives.
As a society, we're not so good about having the patience as other cultures do to have family move in or to have that person move in with family and
Right.
soften the approach to that ledge in the fall. That's not something most Americans are prepared to do.
So what to do? In his book, Who Will Care for Us?, Osterman argues home care workers should be given more responsibilities, like managing chronic conditions,
Here are your dentures.
Thank you.
and especially more training.
If they could do more, they would be more productive. That would justify better compensation for them, which would mean that more people would enter into the market, and we will be able to avoid the shortages we will inevitably face as the baby boom ages.
I'm tearing that off. I'm not touching my hand.
At a recent session in Grand Ledge, Michigan, called Building Training, Building Quality, or BTBQ, experienced home care workers were learning how to train new employees.
So you want a gate belt that has at least 6 inches. They come in all different lengths,
BTBQ
so they can
curriculum
really be
provides
sized to
baseline
who
training
ever
for
they
home
need to
care
be.
workers.
If you
The
put
goal
your
is to
hand on your
attract and
shoulder,
retain
if
more
Chris
people,
starts, but
because
you're
last
trained
year
to walk
the
with people
industry
like
had a
this.
median turnover rate of 67%.
We're constantly looking for other ways to retain our staff.
Participant Alyssa Lawrence thinks more training could lead to higher job satisfaction among her employees.
We're trying to break that stigma of you're just a home health aide. So this way we're looking at trying to better educate them, better train them, and hopefully retain our staff a lot better.
But here's the problem. More training in no way guarantees higher pay.
I was godsmacked on how little they pay for this.
After Wendy Martin lost her automotive job, she decided to run a home care agency with her mom.
If your workforce is better qualified because they've gotten the training that you're learning how to give, are they going to earn more money?
Probably not.
The reason for that is most long-term home care is paid for through Medicaid.
The financing system is a tremendous challenge. Medicaid has to compete with education and public safety for resources. Medicaid today caps what you can do for these aides in terms of compensation.
But he says if home care workers were better trained and higher paid, Medicaid and insurance companies would actually benefit economically because patients would avoid more expensive medical care.
Fewer emergency room visits, fewer readmissions into hospitals. Secondly, they will save money because they can shift some work from higher paid folks, largely nurses, to these aides. And they will save money because they will avoid unneeded nursing home entrances.
Claire Luz says the Michigan training program has already provided evidence of cost saving.
We were able to demonstrate empirically an association between this comprehensive training program and expensive client outcomes like falls and emergency room visits. Just from an economic standpoint, a business standpoint, it's foolish not to be looking at this workforce.
Your hair is very, very curly and pretty.
Henrietta Ivy has many years of experience. But she says when workers like her care for clients dependent on government reimbursements in her native Detroit, the pay is still a measly $9.50 an hour.
They tell you get skilled, get trained, and we do get skilled and get trained, but that money has not changed. It hasn't.
After talking to her for a while, I wondered, could Ivy cater to private clients who could afford to pay more out of pocket to a loving, seasoned pro like her?
Maybe it's that there's a big entrepreneurial opportunity.
You got a good point there, but say for instance, me and a group of home care workers say, you know what, let's just start a home care agency. If we don't have money saved, which we don't, because we don't make no money to save anything, to think on that level, those are our barriers. When you don't have that money for your basic needs, those type of ideas are just ideas for us.
We work, we sweat.
So Ivy has become an activist with the Service Employees International Union to press for higher wages.
Somewhere, somebody's going to snap and say, you know what? We see the problem here now. It ain't that people don't want to work. It's not that people are not smart enough. We're not paying them enough. That's why I like to hear that sizzle.
And says Paul Osterman, if we want there to be more home care workers like Henrietta Ivy around when we need their services, we'll have to advocate for them too.
We're going to need help, and we're going to wonder where it is and why it's not forthcoming. And then we will complain, and there will hopefully be a politician who will see it in his or her interest to make this their issue.
For the PBS NewsHour, this is economics correspondent Paul Solman reporting from Michigan.
You're welcome.